My name is Ashley. I'm a healthcare professional in northern Texas and southern Oklahoma. I do want to thank you all for organizing this. I think having the avenue for the community to speak with one another and understand all of the issues we're facing in different fields is really special. So thank you. My question is about the concern for rural hospitals and rural assisted living facilities with potential for basically what you had stated, there's the risk that they could face some turmoil. What is your perspective on telemedicine opportunities in rural settings? And second question is, do you think that the USDA will be lending more federal aid in the terms of like a community facilities loan in order to increase access to telemedicine given where we're at?
Yes, well, that's something, that's been on my list for ever since I was first elected 5 years ago, because we were fighting the closure of rural hospitals. We try to find new ways to recruit doctors. We don't have enough nurses. We don't have enough pharmacists. We don't have enough. So one of the things I did is created a pilot program with Texas Tech University Health Science Center. There's some federal laws, and Trump has actually waived those too. I forgot to mention that. They're called HIPAA laws, and they're communication laws. Everything has to be double encrypted. In other words, you can't just get on FaceTime with a first responder, a firefighter, and Matador, and FaceTime somebody at the medical center and ask them what to do. So what I did, we found a little money, and we put that encrypted communication equipment in those first responders' vehicles out there in West Texas. So when they came up on an oil field accident or a crash site or somebody got shot at the deer camp or whatever, they could link back up to that health science center through telemedicine. And it's worked great. We're probably going to be able to expand that program. We also did the same thing in Galveston with the Shriners Burn Hospital for Children. Well, of course, the first 15 minutes of a burn victim is critical, absolutely critical. And let's face it, these first responders out there in West Texas and North Texas, they're just merchants and they're farmers and they're pastors and they're teachers and they're not really highly trained medical professionals. I mean, you are, but they need a little direction. So that's what we've been doing on that. One thing that's come out of this that will be good is it's highlighted the need for broadband in rural Texas. We were working with USDA. We've already brought down about $19 million to address this situation, working mainly through our rural cooperatives. It's kind of like the old REA program, but it's a shame that, someone's kid has to drive into town and sit in the parking lot, to do their homework. But we need that same type of broadband width out in the rural parts of the state so our telemedicine will work. Dr. Ronny, you want to chime in on that?
You bet. Yeah, I think I'm pretty savvy with telemedicine, and the reason being is because at the White House, I traveled all over the planet. I mean, I was at 120 something different countries, and a lot of times we were pretty remote, pretty isolated. We carried what we could with us, and we had surgical teams in attendance when we needed to or whatever. But when the president wasn't with me and I was traveling on my own with other components of the White House and stuff, a lot of times I didn't have those resources, and I relied on telemedicine. We had a really robust telemedicine program. Telemedicine is hugely capable. There's a lot of pushback from some of the older population who don't want it to replace their FaceTime with their doctor, and it can't do that. It can't replace your relationship with your physician, and there's certain things that telemedicine doesn't apply to. But the commissioner's right. If we can get broadband expanded the way we need to, you would be astonished at some of the stuff that you can do with telemedicine and do really, really well. So I'm a huge proponent of telemedicine, getting it out there. I think that I don't want to beat a dead horse, but like I said, a lot of stuff's going to come from this. And one of the things that's going to come from this is the fact that we haven't been effectively utilizing our telemedicine resources, and I think that we will. And I'm going to fight hard to make sure that we do everything we can for rural health care. If I'm blessed enough to represent the 13th congressional district, I'll be another position in Congress, and I'll be part of the Doctors Caucus. And one of my main issues will be health care and health care reform, and the focus will be on rural health. And, I grew up in a small, rural farming community, and I know what it's like, to not have ready access to quality health care and to rely on a local community hospital. And I remember growing up, I would go to the hospital in my small hometown, and at the time I didn't realize it, but once I became a physician, I was a little concerned, looking back on that, where you would roll into the emergency department, some kind of emergency, and the only person that would be in the emergency department would be a dermatology resident that was just moonlighting and making extra money working in the emergency department. And as a board-certified emergency medicine doc, I'm not real comfortable with that. So I'm going to work hard to make sure that folks in rural Texas have quality health care that's just as good as what's available in our urban centers.